Hello, hello. Muito boa tarde para todos. Mais uma live, estamos aqui falar um pouquinho sobre inglês, inglês na enfermagem. Vou esperar o pessoal entrar um pouquinho. Boa terça-feira para todo mundo. Quem tá entrando aí. Mais uma live, Nursing Connections, comigo hoje. E hoje o tema será inglês, tá? Se você tá aí no seu processo de inglês, de aprendizado de inglês, se você ainda não começou ou tá estudando para o NCLEX, independente aí da etapa que você esteja, mesmo se você não for enfermeiro, mesmo se você não está fazendo o seu processo de validação, vamos falar um pouquinho sobre inglês, um pouquinho sobre a importância do inglês e, claro, praticar o nosso inglês, né? Porque é preciso. Bom, se você... vou começar primeiro em português para explicar um pouquinho. Se você não entrou aqui porque viu e não sabe o que está acontecendo, hoje o tema é inglês. Então, para quem não sabe, a gente acabou de lançar o nosso English for Nurses Masterclass e tem sido muito bom. A gente tem tido ótimos momentos com os alunos e eu quero mostrar um pouquinho de como que é, talvez, a aula, o que a gente faz, e mostrar um pouquinho, né, a little preview de como que a gente pode praticar o nosso inglês mesmo aqui. Então, vou falar um pouquinho no final mais da Masterclass, e no final, se vocês tiverem dúvidas, ou se alguém tiver alguma dúvida sobre a Masterclass, sobre qualquer outra coisa, no geral, será um ótimo momento para isso, ok? Mas por que a gente sempre fala do inglês, né? A gente sempre tá batendo na tecla do por que o inglês é importante, gente, vamos atrás do inglês. Se você está nesse processo e você quer ser enfermeiro nos Estados Unidos, se você quer poder morar e trabalhar nos Estados Unidos, não tem mistério que o inglês é necessário, tá? E a gente sabe que cada um tem o seu nível de aprendizado. Cada enfermeiro, cada pessoa aprende inglês da forma que é melhor para eles. Mas no final do dia, o que determina se o seu inglês é bom o suficiente é se você consegue se comunicar, né? Então, você consegue entender a pessoa e a pessoa consegue te entender? Se sim, show! Você então tem a fluência suficiente para morar e trabalhar nos Estados Unidos. E, gente, eu tô falando especificamente agora de enfermagem, tá? Enfermeiros nos Estados Unidos. Eu sei que tem várias outras profissões que talvez não necessite do inglês tão fluente, ou até estados. Isso eu não tô levando isso em consideração. Vamos falar sobre a enfermagem, né? A enfermagem internacional. E que muitas pessoas, às vezes, vão pelo caminho de o inglês para a prova, inglês para NCLEX, inglês para, enfim, inglês para alguma etapa específica do processo. Só que esquece que tem todo o resto, tem vida pós-processo, tem vida pós-NCLEX. E tem um trabalho que você vai ser contratada para fazer. E se você acabou de se formar, ou se você é enfermeiro faz 20, 30 anos, você conseguiu ver que a responsabilidade do enfermeiro é muito grande. Então, você tá lidando com vidas ali. Então, não é só ter o domínio de talvez de uma técnica ou de um procedimento. Você tem que conseguir se comunicar com o paciente, com a sua equipe, com família. Assim, o seu nível de comunicação tem que estar num nível de fluência, né? Que a gente sempre fala. De você conseguir entender eles e eles conseguirem te entender. E eu não tô falando de sotaque, que tem pessoas que têm sotaques, tem pessoas que têm o inglês mais puxado. E, gente, isso aí existe em qualquer local, tá? Até nos Estados Unidos tem estados que o inglês é assim, você fica, o que essa pessoa tá falando? ou até países, né, que falam inglês, que o inglês muito também bem diferente. Mas eu tô falando daquela pessoa padrão, normal, sem muitos sotaques esquisitos, que é aquele normal, né, que talvez se tenha um sotaque, é um sotaque que você consiga entender. Você vai ter que ter essa habilidade de conseguir comunicar com eles e eles com você. Então, por isso que a gente prega tanto, a gente fala tanto, parece um disco quebrado, né, sobre o inglês. Mas eu queria um pouco praticar o nosso inglês. Eu vou falando, e aí se vocês quiserem escrevendo, comentando, entrando junto no que a gente vai estar falando, sinta-se livre. Eu sei que não tem como a gente ter um diálogo por ser uma live, mas nas nossas reuniões do nosso Masterclass, que é a cada módulo, a cada 2 semanas a gente faz um encontro ao vivo, elas têm essa oportunidade de responder e praticar o speaking. Hoje não tem essa oportunidade, mas talvez você vai conseguir praticar o seu listening, depois talvez seu writing, então vamos ver. So, now, all in English, so we can practice our English and see, is your English good enough? Why am I saying, is your English good enough? Because if you do not have that ability to speak and have someone understand you and you understand that other person, there is a issue with communication, right? And sometimes speaking the same language you already have a barrier. Imagine in another language. So let's work on our English. This is not to dismotivate you. This is to encourage you and say that, yes, you can learn English well enough to work, well enough to be a nurse, and well enough to do your job well. Okay. So I have here some tasks, some activities, if you say, that you will most likely have to do as a nurse, okay? And I want you guys to tell me if you recognize any of these tasks, if you have done this in the US, or if you have questions about it, okay? And little present at the end of the live session, if you want to see what I was talking about, you will have access to this document. Okay? So, is your English good enough to, number 1, introduce yourself to patients and maybe colleagues, maybe a nursing manager? The first thing you're going to do when you start your job will be, you're going to have to present yourself, to introduce yourself to your patients. So imagine you have 20 patients. You're going to have to say your name 20 times. So it's not just once, it's many, many, many times. Okay? So how can you practice this? How can you have what you're going to say? And I know saying your name is easy, but you're going to say your name, what your role is. So you're going to say, like, I'm your nurse. And then you're going to say something else because they want to know, why are you talking to them? If someone comes up to you and just says, hi, my name is, and you're in a hospital, you're going to want to know, okay, well, who are you besides this person? So for example, you can say, hello, my name is Claudia, and I'll be your nurse today. You can say, I'll be right back with your medications and treatments of the day. Do you have any questions for me? Something everyone here asks, independently of the profession, is, how can I help you? There's a very big customer service culture here in the United States. So the more specific the service, the more customer service they would have, okay? So always ask, can I do anything for you? Do you have any questions for me? And it's gonna be so automatic afterwards. You're going to say it over and over and over again. If you need anything, please let me know. And use your call light. So if you know what a call light is, let me know here in the comments. If you know what that means, if you've used the call light, or if you've if you know what I'm talking about, okay? So you can have a phrase and you can say that over and over and over and over again, right before your shift. And after the third time you say it, you're gonna be able to train it a little bit more, okay? So always have, your name. Sometimes you do forget your name, like, oh, this is my first day here. I'm sorry. My name is Claudia, and oh yeah, I'm your nurse. So, you're gonna have a badge, so it's always great for you to even show your badge. Hi, my name is Claudia. I will be your nurse today. I will be right back. I'm just gonna go get your medications, and I'll be back. But use your call light if you need anything in the meantime. In the meantime, if you know what that means, let me know in the comments. In the meantime is until you do that activity. So there's a space and time. In the meantime, let me know if you need anything. So before I come back, before this next activity, before this next event, that's what meantime means. And you always ask, what is your pain? So a good option is for you to go to that patient's room and say, hey, how are you doing? Do you have any pain today? Is there anything I can get for you? Again, with the customer service, very, very frequently. Okay. Let me know if you guys are understanding, who here is able to understand what I'm saying, or at least learn a little bit, learn a new word. If you didn't know what meantime was, or if you did not know what call light was, call light is a little, sometimes it's like a little stick, almost like a pen, like this. Sometimes it's shorter, and it's literally a button, and the patient presses that button, and a little light will go over their bed, and then over their room. All of the rooms have like a little light, really, like a sensor. And when they press that button, you will be able to see the light in the hallway. So the nurse's station can see all of the rooms that have their call light on. That means it's a patient that needs help. So they're not going to be yelling, nurse! Well, some do, okay? Some will yell. You're passing by and they'll say, hey, nurse! But you're in the middle of an activity, so you always incentivize them. Please use your call light. Please use your call light. Because I might forget that you wanted me, and I might not even be near your room. I might be far away. And sometimes it's something so simple, like, can you turn off the lights for me? Or can you close the door for me? And someone or a tech can do that for you. Okay, so that's what a call light is. Very, very standard across healthcare facilities here, okay? So tell me if that was interesting for you to learn. So we talked about introducing yourself to your patients, right? You're going to do that as many times as many patients you have on that shift. So if you have 15 patients, you're going to be doing that 15 times, at least. You're also going to be introducing yourself to your coworkers, to the charge nurse, to potential family members, to other healthcare professionals. So think about how many times you're going to have to introduce yourself. It's a good thing to practice, right? After you've been at that facility, everyone will know who you are. Like, oh yeah, Claudia. Oh yeah, the nurse. It'll be like, you'll have a coworker family of sorts that people will know you. You will know them. So when they say, oh, Nurse John, you're gonna know, oh yeah, I know who Nurse John is. So, what about introducing yourself to the charge nurse? Something we talked about this past week on our live meet of our nursing masterclass, English for Nurses masterclass, was introducing yourself, and specifically on your first shift. So you're going to the hospital. It's your first shift. You arrive at the hospital. What do? Well, your employer or your agency, whoever you work with, will tell you probably the name of a charge nurse or who will be with you. And we emphasize this a lot. We talked about how you will go to the nurse or who you're going to first approach to find where you are. Because if you've never been to that hospital, You don't know where anything is. You don't know where the nurse's station is. You don't know where the break room is. You don't know where the med room is. You don't know a lot of things. So your first order of business is finding the charge nurse or the DON or whoever there is in charge. So in charge means someone in a management position, supervisor, somebody that can tell you what to do. So you're going to go up to the charge nurse once you found her and you say, "Hi, my name is Claudia. I am the agency nurse for today." And most likely they will know who you are. Because they already received from scheduling from their manager, their supervisor, their director of nursing. Okay, Tuesday, March 10th, or I'm sorry, Tuesday, March 11th, we will have a agency nurse. Her name is Claudia. And so she'll know, okay, yes, you're the agency nurse. Okay. And then she'll right away, oh yeah, you're right there. You're with rooms 1, 2, and 3. So she'll tell you where to go. So you can say, "Hi, I'm Claudia. I'm the agency nurse. I'm looking for the charge nurse, Laura." We gave that name on the live meet, Laura. And just looking to know where I can go. Where's the nurse's station I will be at? Or you can ask, where will I be working today? What's my position today? So that's a good option for you to have. And you might need to do this several times. If you are an agency nurse, which was my case and Jessica's case, and a lot of our nurses here with us that are with Westways, they are agency nurses. And there are many times where we do not go to the same hospital. We go to many places. And we have to do what is needed, right? We have to find ourselves in a place we've never been in, with people we've never worked with, and possibly never will again. I have been in hospitals and facilities just once and never went back there again. And it is possible, okay? I didn't think it was. So if you are on that route to work in an agency as a per diem nurse or even as a travel nurses do assignments. So it's a little bit longer. They're there for possibly 12, 13, 15, 16 weeks. Per diem nurses, sometimes you just go one day and never go back again. So you kind of have to learn everything you need for that one time, and that's it. So it is possible. You might need to do this every time you go to a new facility, but it's like a habit. It's like a habit. It's like driving in the car you've never driven before. The first time, it's like, where do I click? Where do I, some people are great at doing that. My husband is great at driving cars. He's never driven before. I, on the other hand, do not. My car and my car only. So it's a habit you kind of, enhance going to different facilities, okay? Looks like we have more people joining. Welcome if you just joined us. We're talking about nursing, English and nursing, specifically international nursing. If you are looking to be an international nurse in the United States, welcome. You have friends among you. You have a lot of people in the same journey as you. And we're here just to practice our English, because English is needed everywhere you go. In the United States, there are states that speak Spanish, but you're a nurse. You're going to have to speak the main language, which is English. So here we are to train our English and make sure it is good enough to be a nurse and live and work as a nurse in the United States. So let's go to our next example about giving report and receiving report. So this is an activity, and tell me here in the comments if you have done it before, if you've given report, received report, even if it's not in the United States, if it's in Brazil. How's that like? What is that moment? Because if you're not a nurse and you're always here, maybe you're married to a nurse, right? And bless you if you are married to a nurse. You will be rewarded greatly one day. And we're always talking about doing report, shift report. What is that? It is something you do at the beginning and end of every shift. Okay. You cannot start your shift and you cannot end your shift without report. It's I don't even know if it's like illegal. I know that it is a disciplinary action, I think, against your license. Something like this. If you know, tell me in the comments if you think it's also this, or if you're sure what happens if you leave your shift before giving report. I know in Brazil that was also reprehendable by quitting. So you cannot leave before you give shift report, because the patients that are under your care will continue to be your patients until you give shift report. Until you hand them over to the next nurse, they're still your responsibility. So, and trust me, you're gonna want to give report. You're gonna say, get these patients, I want to go home. Even if you love your job and you love your patients, after 12, 13 hours, you're done, right? You want to go home. So giving report is what you do as soon as you get to the hospital, the clinic, facility, rehab, whatever, detox, you get shift report. If you're dealing with patients on a daily basis, you're going to get shift report. And you're going to have to get all the patients that you're going to be taking care of. And then the same thing, the opposite when you leave. You're going to give to the next nurse all of the patients, okay? Not physically. You're not going to, give them physically. You're going to just give them all their information. And there is some informations that are critical, some that are great to have, and some that are not that necessary. Because let's be honest, if you have 10 patients and you're going to tell 10 patients' life stories, you're going to leave in 2 hours because it's going to take forever, right? Some patients are elderly. Some patients have had several surgeries, procedures, treatments. They don't need to know all of that, okay? So, a little acronym that you can use is SBAR, like the letter S, the letter B, the letter A, and the letter R, SBAR. So that is a acronym for things that you can say and things to look for whenever you're getting shift report, okay? If you have heard about SBAR, let me know here if you know what that is, if you know what I'm talking about. So SBAR, S is for situation. So you can say the patient is a 56-year-old male admitted with chest pain. That's your situation. You're telling them what they're there for. Basically their diagnosis, okay? Like what's happening with them right now. B is for background. So he has a history of hypertension and diabetes. It's his background. It's the clinical background, his medical history, pertinent to his condition, pertinent to his diagnosis and reason, okay? You can say, he has chest pain, so he has hypertension. Also, he broke his leg last year. Not pertinent, has nothing to do with his diagnosis, with why he's admitted, okay? It's great. He had a surgery 2 years ago, but it's not relevant, okay? Awesome. See some people that does use SR. Some people don't. Hey, this is not a rule, okay? You don't have to use SR. It's just a good thing for you to a rule that you can use to organize your thoughts. Like, I have no idea how to give shift report. What do I say? So SBAR is an option that you can use, okay, in your shift report. Most likely, whenever you start giving shift report, you're gonna get so good at it because you do it twice a day that you're already gonna know what to say. You're not even gonna remember what does S mean, what does background mean. It's just if you want to practice and on your first couple of shifts, it can help you, okay? But trust me, shift report, you're gonna do it so much that you're gonna, be able to do it like, on the spot. You're there one minute you're charting and the next the nurse comes, oh, can I get shift report? You're like, yes, sit down. I will give you shift report right now. It's just basically, the condition of your patients and specific information, okay? So we talked about S, situation, B, background, A A is the assessment. So now you're gonna say, you already said what he's there for. You already said his background, like medical history, pertinent. And now you're gonna say, why is he there? Okay, he has chest pain. What's going on right now? What's the problem? So his blood pressure is stable, but he's complaining of shortness of breath. Okay, so and in shift report, since you're there for possibly 12 hours, you can say something that happened in the beginning of the day, like, this patient coded. Okay, if you know what coded means, tell me. That is a very good piece of information to tell the next nurse, because it's huge. If the patient coded, that means they needed to have CPR performed, meaning they had a extreme emergency. They possibly flatlined. If you know what flatline is, tell me. So even if that was at 8 a.m, okay, it's 7:30 at night, and you're telling me that they coded at 8, it's a good piece of information, I would say. Now, they had orange juice at 9 a.m. That doesn't matter. Okay. If something is happening right now, he didn't eat any lunch, he's been having he's been having some dizziness lately. I did call the provider. They gave him something. Looks like he slept for a while, but I haven't checked on him since MedPass. MedPass usually happens at 6:30, depending on where you're working. So just tell them what's going on right now. What's the problem? And then R is your recommendation. So it could be either something that you have done and needs to be done again, something the provider said that they were going to do and it just hasn't happened yet. Like, the provider said that they were going to prescribe him, or that they were going to come and do a consultation, but I haven't seen the provider. I'd give it another hour and then I'd call them again. Just call the doctor. He needs to get this prescription in, or let Laura know. Who remembers who Laura is? She's the nurse in charge. She's a nurse manager that she's a charge nurse that needs to know what's going on. Or if there's something that they can do, like, I recommend monitoring his oxygen. We're doing oxygen saturation, pulse oximeter, if you know what that is. It's the equipment that goes on your finger. Very common here. Here, some places don't even have a lot of them, and because they're so individually to use, a lot of nurses will just buy their own and just still use their own. And I recommend contacting the physician if it drops below 90%. So you can say, what do you recommend? Or if it's something that you've done and should be done again in the future, you can also say that. Okay. So, S, situation. B, background. A, assessment. And R, recommendation. So that's a good acronym to have, maybe to practice. You can get hundreds of templates of report sheets already filled out online, and kind of practice saying the words, But basically, it's you're getting your little notes that you have throughout your shift, and if you rather do it on the computer or if you rather do it paper and pen, I used to do it paper and pen. It was easier for me, even though it takes longer for you to write than it takes for you to type. I just felt like I could have that with me, and I could scribble, but a lot of hospitals are very, very strict about you not taking home anything. So you have to shred before going home. So shred is just, not just trash it, not just throw it away. You are, what's the word I'm looking for? You are destroying this piece of paper, and it goes into, if they have a machine that shreds, like, your paper will be cut up into tiny pieces, or sometimes they'll have a big bin, and you'll just, it has a small hole, so you can put paper in, but you cannot take anything out. Your hand does not fit in there. And that is their policy, their protocol for a documentation that cannot be seen by anybody else. So you just put it in there, the company, the hospital, wherever you work for, they'll get that sometimes daily, and they'll do their own shredding. So sometimes they'll say, before you leave, don't forget to shred your documents. So I had a place that also requested this, so I could not go home with any documentation, which is unfortunate because sometimes you're gonna be there the next day and you're like, well, I wish I had brought my report sheet with me from yesterday, but I didn't. And you just might have to get report all over again. If that happens, you at least will know the patients. All right, so those are two situations, two activities that you will most likely have to do, okay? Introducing yourself multiple times, sometimes more than once in a shift, sometimes multiple times during a shift. Sometimes you're gonna have to introduce yourself to multiple healthcare professionals, especially if you're new and you've never been in that place before. It's a lot of different types of healthcare professionals you will potentially work with. And this is something that I didn't really see a lot in Brazil. If you worked in a hospital, the times I was in a hospital, and I never worked as a nurse, it was just nursing school. I only saw mainly the doctor and the nursing team. I didn't really see anybody else. If they were there, maybe one or other healthcare professional sporadically. But in the hospitals I've been in the US, I mean, it's everybody all the time. Every shift. You have doctors, you have nurse practitioners, sometimes you have residents who are, training. And then you have, besides your team, like the charge nurse, your tech, your CNA, you have pharmacy, you have lab, you have physical therapy, you have occupational therapy, you have speech therapy, you have respiratory therapists, and you have so many healthcare professionals who are constantly working on the same patient. It's so multidisciplinary that you just have that. It really is a patient care that is just multidisciplinary. There's really no other word for that. Okay. And now some phrases that you can use while handling a difficult patient or a difficult family member. This is not something that is certainty to happen, but it is common. I had several difficult patients. I had several difficult family members that it's a difficult time. You have to understand that their family member, so their mom, their dad, their husband, whoever, they're sick, right? They wouldn't be a hospital. They wouldn't be there if they didn't have a health problem. So a lot of times these people are just afraid, they're scared, they're nervous about what's going to happen next, and that puts them into a very emotional state, okay? And you're the nurse, you're the person who is going to be there all the time. Because the doctors, they come and go, especially if you're in like a rehab facility, and the family loves to go at 9 o'clock at night because that's the time they get off work, and they can't be there at 10 a.m. when the doctor is there. They go at 9 p.m. And sometimes they have questions for you that you do not have the answer for because it's a medication question. Like, well, my dad took this medication for 30 years. Why is he being put on this medication? And you can explain them the reason, the differences between the two medications, maybe the purposes between the two medications, but in the end, the reason behind the diagnosis is the doctor's. That is the doctor's responsibility, job, function, role, whatever you want to call it. You're there to promote their treatments, to perform the procedures in place. You are there to kind of, nurses, we do a lot of things that are throughout their stay. So we go from admission to med pass to wound care to IV medications, intramuscular medications, whatever, possible referrals that they might need. And just you monitor a lot. You monitor their blood pressure, you get their vitals, you see how their blood sugar is doing. You talk to the doctor. You know, it's a lot of cooperation between the two professions. But you're there a lot of times, and family members will come to you because they expect you to know the answer to their questions. So if you have a difficult family member, tell me here if you've had a difficult family member, and we'll talk about experiences. You can say, I understand you're upset. Let's talk about what's bothering you. So you have that very angry wife, right? Us women, we're so, passionate for our family members, and we get angry when we feel like they are not being treated well. So if you have a patient that is in your care and their family member comes up to you and they're very upset and they're angry and they're shouting, and you can say, I understand you're upset. Let's talk about what's bothering you. Okay, tell me if you understood that sentence. It's a great sentence to have it in your pocket and take it out when you need it. Or, I'm sorry you feel this way. I'll do my best to address your concern. Let me check with the provider and get back to you. Well, that's a great one, because a lot of times they'll have questions about their discharge or billing. They'll literally come up to you and say, why am I getting charged for all of these exams? And I didn't understand before, but after I became a nurse in the United States, I understand now. We nurses have no idea why you're getting charged, how much you're getting charged, for what you're getting charged. That is up to the billing of the facility and the insurance, if there is an insurance in place. That's not, I have no idea, okay? That is another department's job. So you can always say, let me check with, and then you say what? Let me check with the provider. Let me check with the charge nurse. Let me check with the doctor. Let me check with social workers. I had a situation of a very angry family, and it was the daughter of this patient, and she would always come with her husband and I think their child, and she was always very angry because she was not happy with her father's treatment, and she had a lot of questions about discharge. And nurses, we do not put out a discharge plan before they're discharged. Once they are allowed to be discharged, then we can make our plans based on the condition we have that they are going through. But before that, discharge is with the facility and the doctor and sometimes insurance. Insurance will say, we will cover 5 days of stay. So the hospital will make a plan for 5 days. And then they'll tell you to go somewhere else, which is a little bit complicated. So I'm glad I don't work in the insurance part or the billing part, because that can happen. But you will have sometimes patients or family members who are angry and discontent and not satisfied with their treatment. And you won't really be able to fix their problem because you are just following orders. You are just carrying out orders on your computer. You look at your, software, MyChart, EMC software, whatever the software you're using, and you'll have the tasks of the day, and that's what you're doing. That's what the provider wants you to do. Those are the medications they are taking. These are the wound cares that they are doing. This is what they're needing. They're going to be going to physical therapy, speech therapies, whatever therapy they're doing. And you're just there to make sure that that patient gets the treatments that they are required to take. You are not in charge of, which physical therapist they get to see. You can always escalate the problem. Let me talk to the charge nurse. Let me talk to the DON. Let me let them know about this issue. And I'm going to email my charge nurse right now. That way she'll know about this in the morning. And hopefully throughout the day, they'll be able to address it. And guys, on shift report, that wonderful moment you give your oncoming nurse, right? The nurse who's getting shift from you. Okay, so Mr. Smith was here. Okay, his wife was here. And she was very upset. And then you can even list, like, this is what happened. She said this. Please talk to the charge nurse, Lisa, in the morning. Okay, please talk to her. Because if you're night shift, you don't have management there. Okay, you don't have that support. Please talk to Lisa about this because she's very upset, and I think it should be addressed in tomorrow morning. Great, you did your job. You did what you were supposed to do, and you check with that, the other person who can solve that problem. Okay, so these are just some things that you will do. I have so many others, but I don't want to overwhelm everybody here. I don't want to say so many things and then it get lost. The live will be saved. This live session will be saved on our page. But this was just for you guys to practice your speaking, or not your speaking, your listening. And hopefully you learned something cool, something new, something different today. Let me know what you guys are thinking, if you have questions, if you understood what I said. Tell me, were you able to understand what I was talking about? Bom, quem aí conseguiu entender alguma coisa? Tudo? Um pouco? Um pouco de tudo? É uma nova tradição que a gente quer começar de ajudar quem tá querendo melhorar o inglês. De talvez, né, trazer condições, oportunidades diferentes de você que tá querendo melhorar seu inglês. Então me fala aqui que se isso é algo que você gostou, se você quer ter mais dessas oportunidades. A live vai ficar salva na nossa página, então se você quiser depois voltar, rever de novo, né, é ótima oportunidade de você praticar aquilo, né, e o listening é aquilo, é você se acostumar com frases, se acostumar e você combinar aquilo, né, por isso que são as 4 habilidades juntas, né, é o listening, é o speaking, é o writing, é o reading, que você consegue muitas vezes ou você vai ouvir uma frase e você vai saber como que ela é escrita, e vice-versa. Então, é as habilidades vindo juntas, tá? Se você quer ter esse documento ou um PDF de um pouco do que a gente falou hoje, tá? Eu falei um pouquinho só de tudo que tinha planejado. Eu tinha planejado tantas coisas, mas é claro que eu não quero dar todas as informações e inundar vocês de frases. Então, hoje foi um pouquinho. Na próxima live eu falo dos outros tópicos. Se vocês querem ter isso escrito, né, um PDF para você ler, talvez que legal você baixar o PDF e assistir a live, e aí você consegue ler e ouvir ao mesmo tempo. Me avise aqui, que aí a gente disponibiliza para vocês. E me fala se vocês gostaram, se vocês gostariam de ter isso mais vezes. Queremos ajudar o máximo que a gente puder vocês enfermeiros ou outras pessoas que não sejam enfermeiros, mas está aprendendo inglês. É claro que o nosso, né, curso, o English for Nurses Masterclass, ele é direcionado especificamente para enfermeiros, mas se você não é enfermeiro, você pode aprender também muitas coisas. Ele tem muito termo técnico, tá? Então a gente fala bastante da grande parte, assim, do dia do enfermeiro. Então a gente fala sobre plantão, né? Shift report, o querido shift report. A gente fala de terminologia, procedimentos, enfim, a gente aborda vários tópicos no nosso English for Nurses Masterclass. Se você gostou, então, disso, se você quer mais, se você quer aprender mais, melhorar o seu inglês, continuamos tendo o nosso English for Nurses Masterclass, está disponível. O link está na bio. Acesse lá, comece hoje. O nosso próximo encontro, Live Meet, será dia 26 de março. E isso é para quem ingressa no curso. A gente faz encontros lives após cada módulo, mas a gente não tá fazendo toda semana para dar tempo de todo mundo talvez alcançar. O nosso primeiro módulo, o módulo 1 foi semana passada, dia 5, do módulo 2 vai ser agora dia 26. Então, se você comprar hoje, você tem a oportunidade de já conseguir acessar o segundo módulo ao vivo, participar, você praticar a sua pronúncia, você praticar seu vocabulário, e você pode assistir a gravação do módulo 1 que fizemos semana passada. E ter acesso ao material de apoio que a gente disponibilizou, tá? Não perca sua chance de melhorar seu inglês, gente. Isso não é pra desencorajar ninguém, não é pra falar que né, você tá longe de ter um inglês bom. Pelo contrário, a gente quer encorajar vocês, empoderar vocês que o inglês bom o suficiente é atingível. Você consegue atingir um inglês bom o suficiente pra trabalhar nos Estados Unidos, pra completar seus plantões e completar seu plantão com sucesso, né? E você ter bons plantões, de você conseguir terminar o seu contrato. Se quiser depois sair da enfermagem, fica à vontade. Mas você conseguir completar, né, aquela missão que você tem de ser enfermeiro nos Estados Unidos. Você fez seu processo? Show. Passou na NCLEX? Melhor ainda. Tá trabalhando? Termine o contrato e, né, comece a viver a experiência americana, que a gente sabe que muitas pessoas têm esse sonho. Então, se você quiser ver, então, o PDF do que eu falei, clique no link na nossa bio. Ele está no nosso site. Se você for na página do nosso site que fala sobre o English for Nurses Masterclass, ali embaixo está lá free material, não sei se é free material, free resources. Tá lá gratuitamente para você baixar. Ele terá outras coisas, tá? Porque eu queria falar muito mais que eu não consegui falar, mas eu fico para a próxima live. Então você vai conseguir ver coisas que eu nem falei ainda. Embaixo tá Free Material. Então você consegue ver, ali tem um botãozinho de baixo no nosso site, tá? E aí você consegue baixar esse documento que eu usei para hoje, tá bom? Pessoal, muito obrigada quem participou. Obrigada por ter participado hoje. E se você quiser, então, começar a sua jornada de melhorar o seu inglês, venha falar com a gente. O English for Nurses Masterclass continua aí aberto as inscrições para você começar. Não deixe essa oportunidade passar. Não deixe para amanhã, porque semana que vem, mês que vem, você vai estar à frente do que você está hoje, né? Quem sabe o ano que vem você vai estar feliz e vai se agradecer por ter feito algo antes, né? De ter tomado um passo de avançar seu inglês, tá bom? Qualquer dúvida sobre English for Nurses Masterclass, venha falar com a gente, pode mandar mensagem pra gente. Ele continua ativo, tá? Tá R$149,90. Acho que alguém perguntou ali. Tá R$149,90. É pela plataforma da Hotmart. Lá eles até disponibilizam parcelamento se você quiser. E você terá acesso a todo o conteúdo a partir do período de garantia. Então, o período de garantia são 7 dias. E você terá acesso aos primeiros 2 módulos, se eu não me engano. E aí, depois desses 7 dias, você terá acesso a todos os módulos, que são 10 módulos mais um bônus. E você vai poder assistir quantas vezes você quiser, quantas horas você quiser, quantas, né? Não tem, assim, não é compassado e não é horário específico para aula. É tudo, você pode assistir quantas vezes você quiser, quer assistir à noite, quer assistir de manhã, quer assistir de novo, você pode. E a gente tem o nosso Live Meets, tá? De cada módulo. E nós temos um grupo de WhatsApp, que a gente incentiva a treinar, incentiva a conversação e tira dúvidas. Então, não deixe passar essa oportunidade, tá bom? Muito obrigada a todos, tenham uma ótima terça-feira e eu verei vocês na próxima live.